Hi, I'm Dr. Melissa Pilewskie. I am an associate professor of surgery at the University of Michigan, where I'm a breast surgical oncologist and also act as the co-director for the Weiser Family Center of Breast Cancer. I did a breast surgical oncology fellowship at Memorial Sloan Kettering Cancer Center and had the unique opportunity of staying on faculty there for 10 years, where I led the high-risk program and practiced breast cancer surgery, and had a lot of experience in how care is delivered at a standalone cancer center. And one of my goals in transitioning to my role here as the co-director for the Weiser Family Center for Breast Cancer is to bring some of the aspects of a cancer center to a university and identify best practices that we can really integrate into breast cancer care here. I am really passionate about women's health and oncology. When I was young, my mom was diagnosed with cancer, and I remember sitting on her bed listening to her surgeon talk to her, and we didn't understand anything that had just happened. And I'll never forget, but I looked at her when he left the room and I said, I could have done that better. My goal is to meet someone where they're at and to use language that is understandable and to answer questions while we're there. I try really hard to spend as much time as somebody needs in that first visit so that they feel like when they leave, they know what's going on and what our best approach is for next steps. I am so proud to be part of Michigan Medicine because one of our pillars when we think about patient care is how do we individualize this? This is not a one-size-fits-all. Breast cancer treatment is no longer black and white. When we think about surgical management, we have so many options. And so one of my goals when I'm working with an individual is figuring out what is most important for that patient. How can we optimize the cancer care and minimize the potential side effects? So we now know that not everybody needs the most aggressive surgical approach. And that's also true in the medical therapy that we use and radiation. So it becomes a full package. It's a multidisciplinary team. And I think that we really have the best team members in all of these different components of breast cancer care here at Michigan Medicine. The best part about my job is leaving a room knowing that someone just got it. Oftentimes patients come in terrified with the news that they received on a phone call. And when I can break this down to the pieces and the stage and how we're going to tackle this and what the treatments are going to look like, and that our goal is cure, that is an unbelievable conversation and privilege to get to have with patients. And then to deliver that through surgery and remove someone's cancer and feel that rush of relief that washes over a patient, knowing that their cancer is out, is something that keeps me going every day.